Now, doctor, so you've described to this court the injuries, you've described to this court the interventions that you did. Do you recall what time this happened? You are told court 2nd November, but can you tell court the timing when you worked on this patient?
Yeah, I was called to the emergency at just over 8 a.m. And then the patient was prepared and arrived in theater at around 9:43. And then in theater, the anesthesia and all the preparations were done. And my colleague started surgery on the scalp at...
Please slow down. Your colleague started?
Surgery at 11 a.m., but I was there.
Okay.
And then when he finished his surgery at around lunchtime, I also worked on the injuries, which were orthopedic, or the bone injuries and the soft tissue injuries. And then the patient left theater at 3:30 to go into the recovery area. Okay, the theater room where we operate is not the same as the recovery area. And then in the recovery area, she was there for another 1.5 hours, and she was then returned to ICU, intensive care unit, for further monitoring and the resuscitation to continue.
So this recovery room where is it?
It's in the theater, out of the theater rooms where we operate.
So, doctor, so you've described to my lord the injuries, internal bleeding in both forearms, fractures on the 2nd and 3rd fingers of the left hand, fractures on the wrist and pinky finger, a falling off pinky finger, open fractures and exposed bone on the left hand and on the hanging part of the hand, extensive tissues, and a finger that had lost all sensation. Doctor, what would be, together with the head injuries which you described, what would be the impact of those injuries on a person's ability to lift a 1 kilogram object, on coordination in the hands, and on ability to grip?
From what I have as an experienced trauma surgeon, and the nature of injuries I saw in this patient, especially in the limbs, but also the fact that she's bleeding and she's significantly bleeding. One of the things that you get when you've just gotten that trauma is compromise of function, because that's the first thing, especially as far as grasping is concerned. And of course, you get extreme pain when you try to, move your fingers in that situation also. So it compromises your capacity to perform coordinated functions and lift anything. So that's what I can say as an expert.
My Lord, that's it for me. We can take our translation and then my colleagues can have the witness.
May it please you, my Lord. This time, okay. My Lord, for the defense team, I've been informed that Mr. Karego will be joining us. He's actually here. So the representation of parties is as before. And I'm watching brief for the record. They will have Council KATANGA and Edgar. My Lord, the assessors are in court and all the 5 accused persons are present, with A1 appearing from Zirawini prison and the 4 in court. We are ready to go to start with the cross-examination of DW. My colleague Jonathan will take.
We are going to ask you a few questions. We know you are a busy person, so we propose that you give us direct answers and we get done with this process as fast as we can. Just for us to establish, Doctor, when you came to this court to testify for the accused person, you did not come by formal witness summons, did you?
No. I don't know what form of witness summon is.
Use the mic.
I'm not in position to know what
Formal witness summons means a document from court inviting you as a witness to come and testify. Did you receive any formal document from court?
No, I was.
We want to know was it a formal management decision of IHK Hospital for you to come?
Yes, I was told to come through the director of the hospital.
The reason we ask you this is that you are several doctors that, from your evidence, that say handled A1. By A1, I refer to your client. Was the instructions of IHK in writing or verbal?
The director instructed me verbally to come because I'm the one who was in the station at the moment.
Put on record the name of the director.
Dr. Kavuma,
The other name?
I know it's a D, Kavuma D. No, I don't usually interact with him that closely, but I know it's Dr. Kavuma. Kavuma D. What I know is that, I know is Dr. Kavuma D.
Dr. Kavuma.
Yeah,
Okay.
usually.
So again, for clarity, before we divulge into the details, Are you appearing in this matter as a personal doctor of the accused person, or strictly in your official capacity as a representative of IHK?
I'm appearing in this matter as a doctor who treated the patient.
Doctor, as a medical professional, you are bound by the doctor-client confidentiality. Are you not?
Yes. We are bound by the confidentiality.
And it is in your knowledge that by that professional principle, you can only divulge the medical records or details of a patient either by their express authorization or by clearance of a known next of kin. Is that something in your knowledge?
Yes, it's in my knowledge.
By your appearance in this matter, it is in your knowledge that your testimony would involve divulging into the personal medical records of the accused persons, correct?
Correct.
So prior to taking the stand, did you ensure any formal written consent by the accused person in that regard?
No.
Pastor, Doctor, when did you last review the accused person's medical record?
The medical records, I last interacted with the patient's records when she was in hospital before being taken out of hospital, because I was following her up. And I have the records.
When she was last in hospital?
Yeah.
This was in January 2024, correct?
Yes.
Is it your position? Do we get you correct by the position that even when your medical director purportedly assigned you to appear as witness,
Yes.
you never found it fit to refresh yourself or review the medical file in respect of a person you were appearing to testify?
That's a different question, because you told me when did I last review the records. It was when the patient was still in hospital, but when I was summoned to come to court, I looked at the notes again so that I could answer the questions, because this is a long-term period. To refresh myself with the accuracy of the information.
So when did you last review or peruse the patient's record?
Before coming to court.
Do you want to be precise?
When I got to know, that's a few days before coming to court.
Doctor, are you in position to put a date?
No. It is shortly before coming to court, a few days before coming to court.
Okay. When did you last directly talk with A1?
I talked with A1 when she was in hospital,
That is January 2024.
2024.
For the protection of your privacy, there is a number I've written here. You look at it, we shall pass it over to court. I want you to confirm to court if it is your personal telephone number.
It is my personal telephone number.
You have held that telephone number way before A1. Okay, way before the 2nd of November 2023.
Yes.
And the number is in your names.
Yes.
Which names?
Sechinti Patrick.
You held that phone and it was with you or on you on the 2nd November 2023, correct?
Yes.
Doctor, as a medical doctor, in your practice, you are required to detail your professional handling of a patient in her file, in her medical file, correct?
It depends on the purpose of the information I'm writing. If it's for my own record, it may not be as detailed.
Doctor, I'm speaking to information relating to the treatment and management of a patient under your care.
Yes. I write, sometimes even I dictate, but what I put down is for my own review of the patient or for my colleague who is in the same profession who may come to handle the patient. All right?
What's the response? What you put in the
File
depends
on the purpose of the information I'm putting there, yes. Which could be, I want to be able to remind myself the operation I did in theater. Or my colleague to know exactly what is the operation I did in theater. Or during reviews of the patient.
So I'm correct to say it is a standard procedure that everything you do in respect of the management and treatment of a patient is written down in the patient's record. Correct?
I'm understanding this question as the question that was asked before. I write
Please
down.
provide
Yes.
an answer.
I write down the notes that will
Doctor,
either.
I have asked a specific question. Just don't mind, I may even repeat it, and it is on purpose.
All right, all right.
Just provide this court with an answer.
I write down notes to remind myself what exactly I did, or to my professional colleague to understand what I did in theater or during the review of the patient.
So do you write down, do you write details of everything you did?
You cannot write all the details, Your Honor. It will be a very big paragraph. You cannot write down all the details. There are routine things that we do that we don't have to indicate in the theater notes. But if I write the procedure, I know exactly what I did.
There are things that must be written. For example,
The name of the patient, the name.
Just a minute.
Okay, sorry.
But you are correct. So in all cases, you must take the particulars of the patient, right?
The names of the patient must be
Doctor, my question is particulars.
particulars, yes. The issue is that when we do surgery.
Wait for the next question, sir.
Okay, can I answer the question that you asked? Yes, the particulars of the patient,
What constitutes the particulars?
the name, the age of the patient, the team or the surgeons that have worked on the patient.
Those are still in particulars of the patient.
The particulars of the patient, I've finished the particulars of the patient.
Then end there.
And then we go
Wait
to.
for the next
All right, fine.
I just advise you, we don't want to spend much time with you. So just restrict yourself to the straight things that we require. You should also, as a matter of must, indicate the complaint that you are managing.
That answer?
Must you indicate?
The complaint is
Doctor, must you indicate it?
no, not in theater notes. Not in theater notes.
I will ask about theater notes.
Okay, yeah. If in the personal file there can be complaints, but it's not me to write the complaints. If you want me to explain the procedure, I can explain.
I'm not about to ask you to volunteer any information beyond what I require, sir.
So, we note that in the personal file, the complaint
Yes,
must be written, although it is not written necessarily by you.
by me. Yeah.
So, Mr.
Doctor,
Mr.
my lord,
the complaint maybe is it same as the reason why the person is there?
Yes, the reason why the person is in hospital. Representing complaint.
Does the personal file also contain the condition of the patient on arrival? Does it?
When the patients arrive,
Does it or it does not?
it should indicate
It should.
the condition of the patient.
Should also include the details of medical procedures undertaken. Correct?
Correct.
It is correct, therefore, to say that the personal patient's file is the principal source of information about what the patient is being managed in a medical facility.
It is partly the source of information.
Other than the personal file, doctor, where else do you record the patient condition and issues related to the management of the patient's conditions?
In the report or reports made by the professionals who manage the patient.
Doctor, reports, information in reports is derived from the personal record of the patient, correct?
The information is derived from the records and what I saw as a professional.
Do we understand you to tell this court, to be telling this court that there are things that you see that you don't write in the patient's file?
The fact that we are two doctors managing the patient.
Doctor, I'm referring to you, things that
Yes,
you personally
it's
did.
true. It's true. If something has already been recorded by a colleague,
No.
I don't have to repeat writing it.
I'm asking about, then
Yeah.
if your colleague is the one recording, it is already in the file, you know? I want to be sure that you understand
Yeah.
this.
Because my duty is to write the orthopedic injuries as I saw them.
Now, doctor,
And
we'll
I
come
managed
to
them.
what you did
Yeah.
personally. Now, this,
Even this
general
is on record that I write what is in my area. If we are managing it as a team, manage the patient as a team.
I was asked whether are there things that you saw that you don't report?
Yes, there are things that we don't record.
So there are situations where you manage patients for specific conditions and you don't record them down in their file. That's what you...
Yes, I may not record all the details. All the details, I may not record them.
Doctor, I'm not now asking about details.
Yeah.
I'm asking about the subject. I come to your hospital, you manage me for malaria, and you choose not to indicate that I came suffering from malaria. You understand that example? You may not tell the particulars of the gravity and what have you of the malaria, but the fact that I am suffering from malaria, is that something that you can omit to put in my personal file as a medical professional?
If you are suffering from malaria, for sure I write that you are suffering from malaria.
Okay.
But I may not put that you are suffering from fever and headache and everything.
Okay.
Because I've already judged from the symptoms I've seen, and it's malaria, then I write it's malaria.
You talked about things recorded by surgeons and things recorded by other medical professionals.
Yes, sir.
As a surgeon, you record operating notes or operation notes in theater. Is that how you call them?
Yes, sir. You record or you dictate, but that's what you record.
How about on ward?
On the word, you can either record or dictate what the junior writes.
In the theater, it's operation
Yes.
notes.
Yes.
How about
On the word, it is review, follow up, and sometimes if there's not been clerking
What
before,
do you write? Are they still operation notes or clinical notes?
those are notes about the patient's progress.
Okay.
Yeah.
Are they otherwise called clinical notes?
You can call them clinical notes.
Now, about the reviews on word. As a medical profession, when you review a patient, you document what you have reviewed when you review, correct?
Yes, sir.
Is it professionally correct for one to review and not document in the patient's file what they have reviewed?
There are two ways of recording.
Is it correct or not?
Yeah.
my
Yes,
question-
I'm answering your question, by the way.
Very
Can I
delicate.
answer it, Your
Please.
Honor? Yeah. There are two ways I record information. When I go to review a patient, I go with the word doctor. And I either give the word doctor the instructions on what to do, okay, and the progress of the patient, or I write down myself. That's the way I do my work.
Doctor, either way you have written, whether you have written personally or instructed a junior to record on your behalf, you have written.
No,
Okay.
those are two different things.
So review notes must appear,
Appear.
whether it is by you
By
or
me
on your
or
instructions.
my doctor, my whatever, junior
Yeah,
on the word.
that's exactly what we are saying. Do you hold any administrative position at IHK?
No, sir.
What are you exactly at IHK?
I'm a consultant orthopedic surgeon.
Lord, she could interpret before we go further. Delivered at the emergency section, he is first attended by the emergency staff at
Yeah.
that section.
Yes.
It is at the emergency section that the patient is assessed for their condition.
Yes, largely at the emergency section.
And your colleagues at the emergency section fill out an assessment form of the patient?
Yes, they fill the chart. Start filling the chart.
Doctor, I know the form and the chart. Can you answer us to the form?
It's a chart. At IHK, I know the chart is the main item. Because everything is in the patient's file. We call it the patient's file. It's opened up, and then you put in the different forms or papers that will be required in the management of the patient.
So the chart.
The chart has all the necessary paper for patient to be admitted.
Doctor, I will ask about the chart. Do you know about the IHK accident emergency assessment form? You are supposed to have reviewed the medical record of this accused person.
Yes, in the emergency situation, I reviewed and knew what had happened to the patient.
I'm asking about the assessment form, doctor. Are you familiar with the IHK accident emergency assessment form?
I'm aware about the medical records in the emergency department.
My lord, will the witness answer us to the assessment form?
I'm aware
What are you aware about?
about the assessment form
Okay.
and what is written on by the
Okay.
medical
Yes.
officer or whatever.
Subsequent surgeons or doctors review as the assessment form as the first point of internal information regarding a patient.
So they mentioned an assessment form, and the IHK accident emergency assessment form is something I'm aware of, and I'm also aware of what is written in it. So it says it is at the emergency section that the patient is assessed largely for their condition. After assessment, a chart is filled. Then I reviewed the assessment form. The IHK accident emergency assessment form is something I'm aware of, and I'm also aware of what is written. He says he talked about the chart, and he said that he's also aware of the emergency assessment form, and he's also aware of what is written.
Yes.
Yes. After assessment, a chart is filled. That is the main thing, filled at IHK. And then I asked him that is a chart the same thing as a file? Then he says the chart has all the things about what concerning the handling of the patient.
We were availed these documents by the defense. I'm going to put to you the emergency assessment form. everything. Okay, they are done. Please look at the document. That is the emergency assessment form in respect of the accused person, correct?
It is the name and everything that should have been for that patient. Probably. I mean,
Please use the microphone, doctor.
it is identifying the patient.
Doctor, is that the emergency form in respect of the accused person, A1?
My Lord, I'm sorry to interrupt. My Lord, when we were leading the witness, we were not allowed to show the witness documents he had not written. I don't know if background has been established to show that the witness is the author of that document, and therefore he can speak for it.
My Lord, this witness is here in his official capacity by his own evidence. He is also here as a representative of the hospital. He
I'm
is
not
also,
I'm not
Doctor, will
representing.
you please.
Okay.
Okay.
Finish then I come.
He is also here, my Lord, upon having reviewed the patient's file a few days to his appearance. My Lord, that background was deliberate, and we were seeking to establish under what circumstances he came. The doctor chose to say that he's not here on private invitation, but on instructions of his hospital.
I saw here that he said, I reviewed the assessment form. The IHK accident assessment form is something I'm aware of, and I'm also aware of what we do. So,
Doctor, it is never late. Okay.
we talked about having looked at the assessment form. Maybe we can listen.
Can I answer?
So that we save on the time, because we have just begun on these documents. Are you familiar with the documents that you reviewed about the accused persons on being assigned to come here and testify?
I reviewed the documents of the procedure and
Doctor, the question is,
yes.
are you familiar? Please be
Yeah,
kind
with the
to us
documents.
and answer
Yes,
the question.
that's what I'm answering.
No, please.
You don't
Do
have
not
allowed-
set yourself questions. Are you familiar is the question?
With
With
what?
the medical documents relating to the client's file that you reviewed before coming to this court?
The documents I reviewed, I'm familiar with them.
Doctor, that patient assessment form is part of the accused's file, correct?
Correct.
So get the document.
See.
Who managed A1?
Have we established that we reviewed that document? That maybe we can miss that.
Said that I am familiar with the documents I reviewed,
Yes.
which were in the file.
And where I got directly involved in the patient's management.
Doctor, in the management of the patient,
Yes.
do you look at everything that has been given to you in the
in the real time, you look at it, and that's at the emergency section, right? And a lot of things are happening. But then you get time to interact with the patient, and you beef up your understanding. After you've operated the patient and you are reviewing them, you understand the story even better.
But you start with the file.
But you start with the file, and
Is that what you're calling the chart?
that's the chart I'm talking about, yes,
So the
which has
chart-
everything.
The chart has everything.
Everything, yes.
So you
In
go
the real
back.
time, you go and see,
But
and you ask what has happened and that kind of thing quickly, and then you what? You know what has happened, look at the x-rays, and you know that this is now an injury that I have to manage, and you become part of the team to manage the patient.
So are the x-rays and all that part of the preliminary assessment?
Yes, we do x-rays. It's very important to do x-rays.
Before the
Because,
the
yeah, because that's what
orthopedic-
makes me,
Are you the one who does the x-ray, or you find the
Some-
x-ray already done?
these ones I found when they're already been done. Because the emergency doctor had assessed the patient. Then I review, and because that's why they invited me to come and manage.
So, but I think what court will be interested in knowing, you as a surgeon, when you are presented with a patient, you are also presented with a file, and you review the information already taken down to understand the complaint that you are to manage. Isn't that standard procedure, doctor?
The first thing,
Is it or no, it is not?
no, can I answer, sir? The first thing I do is to
Doctor.
find out what has happened.
What is the purpose of the file then,
And then,
as far as you're concerned?
As-
how
as-
does the file, how does the chart
Uh-huh.
help you in managing the patient?
in managing a patient.
Yes.
Now, if there is no capacity of the patient to probably speak at the time I see them, then the chart is very important. But if I've been in the emergency situation and I know, or I've gotten from the doctor exactly what happened, I may not look at all the nitty-gritty details of what he has written down, because he has told me exactly what has happened, and he has written the notes as he has had the story and that kind of thing.
What
But-
is the purpose of the initial emergency assessment form in an emergency?
In an emergency situation, is the patient alive? You want to establish, is the patient alive? Where are they being referred from? And the other details around the injury that you're given to, that are given to the health workers by the what? By the attendants, or the patient, if she can still speak at that point.
So you, in other words, in your patient management at the initial stage, the information contained in the assessment form is relevant to you.
It's very
It
relevant.
informs your next actions.
It is relevant, but I usually ask my own questions as a specialist.
Doctor, you are setting yourself several other questions.
It is okay, sir. I'm here to answer questions, and I have to tell you what I do. If I don't tell you the truth, then it's not.
I'm not requiring what you do. I am asking specifically. And please, kindly, doctor, we are asking simple questions. Give us direct answers. Okay?
So you are saying that the emergency assessment form, you may look at it or not?
You may look at it, but not in great detail if you know that you've gotten the information you want. Because remember, this patient is being managed by a team. The neurosurgeon was already in the emergency situation, managing his wounds, okay? And I'm called in to assess the orthopedic injuries that the patient has acquired, and I assess and I realize that I need to be in the theater together with the neurosurgeon, or after the neurosurgeon, to manage the injuries.
So in this case, were there two different emergency assessment forms? One
No,
for
it is the same.
neurosurgery
It is the
and
same.
for orthopedic.
It is the same.
So
It's
you
the
as
same.
an orthopedic surgeon, are you informed? Do you find the information in the emergency assessment form relevant to your next action?
Yes, I find the relevant information in the form that I will use in management of the patient. and then I add on my own assessment.
Doctor, let's deal briefly with this emergency form that relates to your circumstances. Which doctor managed the patient at emergency?
Your
Can you
Honor,
go to page 3?
Your Honor, due to the length of time,
You've
I may
forgotten.
not be
That's
in
why I'm
position to
referring
say,
to page number 3
Yeah.
of the document.
okay? And, okay, number 3, all right?
Which doctor managed A1 on arrival?
Your Honor, the turnover of doctors, junior doctors in the emergency
Doctor,
section.
does page 3 provide you
here-
with the information?
Here I'm reading Kapuma Peter. That's what I'm reading from the form here.
Do you,
Peter. Yeah, Peter.
Kavuma Peter?
Yeah.
Things after 2 years. I believe that is why you had to be accessed the file before coming. What time did he manage the patient?
Your Honor, I
Still-
managed the patient.
What time did he?
On that
We are dealing with your
does the-
official
does the
record.
form capture the time?
But my lord, can he answer questions about what another person did? Will that be eliciting hearsay?
We have been down that road, my lord. We have laid the background. If the good doctor had said he's here in his private capacity, he has nothing to do with the official records of the hospital, my lord, we would not be asking, we would not be bothering him.
I think my lord, he did say that he's not here representing the hospital. I think he said he was sent by the hospital, but he's not here as a representative of the hospital.
So he was sent by the hospital
But my
to
lord, my
represent.
objection though is whether the witness can give evidence about what time another professional handled the patient. My lord will recall that when I was leading the witness, I was stopped from asking the witness questions about what another professional had written.
So, Mr. Morgan, how do you distinguish that from this current position? The doctor couldn't really ask about what the neurosurgeon had done. How is that different from the personal assessment form, which was filled by another?
I beg your pardon, my lord.
So the witness could not answer questions regarding what the postmortem doctors wrote.
Yes,
Not the detail or not giving
Exactly.
opinion, but exactly.
exactly, my lord. Exactly.
Although my lord, in this particular case, the neurosurgeon were commenting also about the official hospital record as recorded by the neurosurgeon. So my lord, the situation is the same. There are three doctors we're talking about: the emergency doctor, the neurosurgeon, and the orthopedic surgeon. My learned friend objected that the part, because he had started explaining that on page 8, this is what the neurosurgeon wrote, and the objection was he should not comment on the record as put down by the neurosurgeon. So our objection, my lord, is that it is the same scenario with the objection as put down by the emergency doctor.
My lord, if I may, the actual difference is whether it was a neurosurgeon or him, even his procedure alone, he needs information from the emergency to guide what interventions he's going to say and he's going to do. And that is what he has just told us, that the information that he receives from emergency is critical. So meaning that even in his own capacity, he has to review what comes from emergency before he takes on as an orthopedic. So we are not putting him to answer questions of the neurosurgery, but in line of what he did, he starts from there as well. And I don't think
that I find the relevant information in the emergency accident form, emergency accident emergency assessment form,
yes, ma'am.
which I use in the management of the patient.
And that is where we are going to find.
He said, then I add on my own assessment.
He said, I find the relevant information on the emergency assessment form, which I will use in the management of the patient.
Yes.
I will then add on my own relevant information.
Assessment. I do my own assessment.
I will then add on my own relevant
Assessment.
assessment or information.
Assessment.
Because he assesses.
And that is why we are taking
Discretion.
him to the emergency.
So he interacted with the emergency.
Yes, madam.
Because here he said, I find the relevant information in that form, which I will use in the management of the patient. I will then add on my own relevant information.
So, doctor, what time was the accused managed at emergency, according to the form, the hospital form?
Your Honor, I beg to answer the questions pertaining to what I did, because that's what I was told from the beginning. But because the hospital has an administrator who was actually the administrator then, and he has the emergency doctor, he may give a little bit more administrative answers. But yeah.
My lord, let it be put on record that he has declined.
Yeah.
Yes. Do you concern yourself with the details of the initial assessment by your first action officer?
Yes, they are the first to tell me what they found about the patient. They tell me and they write down what they have found. But they tell me and I review what they are telling me. I review the patient, I review the x-rays.
Required a yes or no. Record of that communicates to you as the next action officer, correct?
Your Honor, the communication is verbal. It's verbal.
So which doctor gave you the verbal communication? In
The
relation-
emergency doctor.
Doctor, here, you wait. I ask, because we don't want to waste God's time. Just be patient with us, okay? So I was asking you, in this particular case, which emergency doctor gave you any verbal information regarding A1?
The one who was on call that day.
By who I require name for court.
I think the administrator of the hospital will provide that name because
Doctor, do you know or you don't know?
you know one thing about doctors, just junior doctors like students,
Doctor,
is
do
asking
you
me
know or you don't
which
know?
student
Sorry, we are
did
not-
this,
we are
which
not
doctor
going to
did
be
this.
a lecture, doctor.
Yeah.
Do you
So,
know or you don't know?
I don't remember.
You don't remember?
Yes, at this point in time.
Okay,
If
that's
I'm
fair.
shown that doctor, I will not remember
That's fair.
because it's 2 years.
Is it your information therefore that in handling the accused person, you only relied on verbal information from that person you don't remember and never reviewed the preliminary assessment by your colleagues in this form?
Your Honor, I review the relevant information in line with my orthopedic work that I'm going to do on the patient. the patient is managed by a team, and the other team
Which
was
question?
already managing the,
Which question are you answering, doctor?
that the question you've asked.
My question is, my lord, did you find information contained in this emergency assessment form necessary for your next action?
Relevant information to the management of orthopedic injuries.
So did you find the information here necessary for your next action? Yes
I
or
said there are two sources of information I got.
no? My lord, will he
Doctor,
precisely
three.
On that form,
answer?
did you find, or from the verbal,
Yes.
from the verbal
For communication and everything, yeah, because there is verbal communication that I got. There are X-rays that I reviewed.
Now I'm on this form.
There's
My
a
lord,
patient I
will
assessed.
reach there. I will reach there. May the doctor be advised.
Because
Doctor, if you
to
didn't
answer
get any
directly,
information from
we
the
can always
form,
reach.
I cannot answer that question because it is a long time. These are routine things we do. You review the information. It means I reviewed the information, but I will not be certain of all the details that I got from the information. But I know that I reviewed the information to get the relevant information to help me manage the patient in the theater. And then when I get that information and I'm satisfied that it will help me to manage the patient,
so
I go ahead.
In respect of the form being asked,
Yes.
you got relevant information.
Yes, relevant information, Your Honor.
I thought he had said that he, I thought he said he got verbal information from the X-ray. He may have looked at the form, it's a long time ago, so he does it. That's what I had understood.
My lord, whatever he said is on record.
But he has
That's-
said that he got the relevant information from the form.
Yes.
Which was relevant.
For example, the name of the patient. Okay? So what I'm saying is that you collect all the information and get the information that you feel is enough for you to manage the patient and to go to theater. So
I want to advise you, doctor, that at this rate and the method you have chosen to engage, we may not finish you today. And yet, we requested that we ask a simple question, provide a direct answer. You're a busy man. We don't want to keep you here for a longer time. Doctor, we are instructed, and please humbly tell this court if our instructions are correct or not, that you were not at the hospital by the hour of 9:43 when you claim to have interacted with the accused person on the 2nd of November 2023.
false.
You are not at IHK hospital.
That is false information, Your Honor. I was at the hospital.
Nine what?
43, where the patient was going to theater.
9:43, my lord. In fact, you were not anywhere at IHK until about 11 o'clock on that day.
False information, Your Honor. I was in the hospital and I wouldn't have endorsed the patient being taken to theater for my procedure without reviewing the patient. So it's false information, Your Honor.
The reason you do not want to mention, or you decline to mention, the time of assessment is because what is on the official record of the hospital shows that by 9:45 the patient was being reviewed, and it contravenes your version that before this time she was in theater. That's why you cannot even mention the time 9:45, clearly written by Dr. Kavma.
My Lord, I'm sorry to object, but I'm not sure that the witness has said the patient was in theater at 9:45. I thought the patient in evidence yesterday said that.
Did I say 9:45?
Yes.
I thought he said that the patient was in theater at 11.
No, the 9:45 I'm referring to is the time he does not want to read in the official record. So it is the time, my instructions, that he is evading that particular record on purpose because it contravenes what he purported to be the fact in this court.
So, but just to be clear, you're saying that at 9:45 the patient was in theater. Is that, that's my understanding of the question. I just want to be clear.
I can always repeat the question, my lord.
Please repeat it, Mr. Morgan.
Doctor, the reason, my question is the reason you are uncomfortable reading the time of assessment by your colleague, Dr. Kavma, which is 9:45 on the official form, is because it contradicts with what you earlier told this court, that by 9:43,
The patient
A1 was in theater.
I beg to tell you, Your Honor, that I reviewed and inquired from the administration of the hospital about the timelines. And that is what the director of the hospital informed me, those timelines. But I also have a recollection of what happened on that day.
Wait a minute, doctor.
For some details, because you
Wait a
cannot
minute.
get all the details right. But those are the details.
Doctor, let's write slowly.
Yeah.
So the
Yeah.
timelines
Yes.
you gave in court.
Yeah.
Is what you were
From
told
the administration.
by the hospital.
Yes.
Administration.
Administration of the
So
hospital.
who told you specifically?
The director of the hospital, Dr.
So is
Kavuma.
the one that
DNS.
told you about the
Yeah.
timelines
Yeah.
you gave to this
Yeah.
court? Okay.
So that one can be.
We can write that first, please. Okay, now we now get it clear because we had mistaken it to be your personal information. Doctor, in accident emergency cases, they are preliminary things that are a must do before theater. Correct?
Yes, sir.
For example, before I give the example, and these, in medical terms, constitute the pre-assessment procedures.
I don't name, first mention them, sir.
I will mention,
Yeah,
but
mention them, then I'll accept or let him mention them.
so as part of the pre-assessment procedure, a CT scan is a must do. For orthopedic cases, let me be specific in your field.
Can I answer, Your
Yes
Honor?
or no? Yeah, I want you to tell this court yes or no.
No. Not for all injuries.
X-ray,
Yes. If you have assessed and you suspect fractures, it's a must that you should have it.
For theater, blood assessment,
Yes, it's important, especially if somebody has been bleeding and they're anemic.
in fact, to be clear,
It should be anyway done anyway for all cases, for theater.
I thought you are
No,
qualified.
no,
with-
no, I'm not.
Okay.
Yeah, in the emergency situation.
In fact, Doctor, for the information of this court,
Yes.
you have to ensure that there is available blood before proceeding with the surgical process.
Yes, as a team, you must ensure there is blood before proceeding with the procedure.
Did you know that the accused person had been handled by the radiology department of your hospital before your intervention?
I found that the x-rays had been done.
Doctor, do you know who ordered for the x-rays?
The emergency doctor.
In your practice, you will agree with me that before ordering a procedure, you first assess. Is that the procedure? You first assess before ordering a procedure.
Yes, you do that.
I want to interest you with your hospital record. Yeah.
Ehandiko bino ebizere tugambirwa
Doctor's an orthopedic surgeon. Did you find the information from the Department of Radiology relevant for your next actions?
I had a chance to look at the x-rays and I found them relevant for my next instructions.
Doctor, did the X-rays come along with a report? Did the X-rays come along with a report from the Department of Radiology?
Did
they or they did not?
I mean, those are very, very serious details that, I mean, whether the report came later or, but I saw X-rays and I assessed the X-rays.
I'm not even sure,
So,
Doctor, with
so,
due respect,
so
that you
with
understand my
about the
question.
report being with the X-rays, at this time after 2 years, Your Honor, it is so.
What is the answer? You either know or you don't know. You either
I know that I
remember.
saw the radiological report
So what is
of
the
the patient.
answer to this court, Doctor?
And the radiological report of the patient that is important to me is the X-rays.
I'm not here to ask
But
what is
the-
only important.
Is the X-ray accompanied by a report? usually?
Sometimes the report comes after the X-ray has come because it's an emergency. Sometimes I even go to the radiology and I look at the X-rays in your time after they have been taken because it's an emergency.
So, Doctor, do you have a fair recollection of what happened on that day?
Yes, I mean, it's a fair recollection.
So
I was in the
will
hospital.
Will you tell this court, if you remember,
Yes,
whether the X-rays came with a report from the Department of Radiology?
this is what I remember. I saw
Do you
the
remember or you don't?
Do you remember the report? You remember the X-ray?
Yes.
Do you remember the report?
I mean, I don't remember the report because I saw the X-rays and interpreted them.
When you are reviewing the client on the ward, do you remember interacting with the report, the radiology report?
Your Honor,
Do you or you don't? Now I am going to request that I be more strict on what you volunteer here, Doctor. Do you or you don't?
can I answer that question? I don't remember. Yeah, about whether because the fact is.
You don't remember, that is sufficient. For
So I don't give reasons.
No,
I don't have to
I
reason.
don't require your reasons.
All right. Thank you very much. Go ahead. Interacting with either report or not with.
Now,
Yeah,
when
I
you are
remember that.
reviewing the client's file
Yeah.
prior to coming to this court, did you look at the report from the Department of Radiology that was speaking to the X-rays that you say you interacted with? Did you?
I didn't.
So for the 2 months that you managed Ms. Mole Katanga, you don't remember reading the radiology report, do you?
It was not necessary, and I don't remember reading it because I had seen the X-rays and I had assessed the patient.
Again, Doctor, I want to refresh your memory. Look at the report I have placed before you. Does it refresh your memory as to whether it is the radiology report in respect of the X-rays you claim to have interacted with?
Let me read the report.
The question is, look at it.
Yes. It is saying exactly what I told court. These are the injuries I saw.
Doctor, I am not, my lord, I'm not asking about injuries. If, my lord, he can be advised to simply answer.
Yeah.
My lord, I have not asked about injuries. He shall not opt to pose questions to himself. I've said, look at it. Does it refresh your mind enough as to whether it is the radiology report that speaks to the x-rays that you claim to have reviewed? That is the question.
Now, if I cannot remember the exact, whether looking at the report in that situation,
Doctor, does it refresh
then
your
I
mind
cannot,
or not?
what mind should I refresh,
Doctor,
Your Honor?
you cannot tell
I cannot.
if it is in the report. That's
What I'm saying is that it is saying it's Mole Katanga. The age is right at that time. The injuries is describing exactly
Doctor,
what it
I've
is.
not
So
asked you to go
that's what
into
I can
details.
say, that it's describing exactly. But telling me that this is the exact report, I'm not a document analyst. If I know the information,
so your answer
and I'm
is-
convicted that
so
I know the
your
information,
answer is that the injuries are in the
in
My
the
Lord, I'm not
report,
asking
yes,
is what you said.
yes, what is what I saw,
My Lord,
and I described them to this
My Lord,
court.
I've not asked about injuries. This witness shall answer questions put to him in cross-examination.
Ask a question again.
I asked him, look at that report. Does it refresh your mind as to whether it is the radiology report relating to the x-rays that you reviewed? My Lord, this question requires him to look at it and tell court if it is or it is not, and he waits for the next question.
Yes, it is the report that that followed the X-rays.
Are you seeing it for the first time in this court?
Your Honor, I have answered that question.
My Lord, I'm asking this question for
I
the
would
very
be
first
genius to remember whether I looked at it or didn't look at it. I would be genius. But I know that I assessed the injuries, I looked at the x-rays, and I documented what I
time. My Lord,
found.
that is not my question.
So
That
about
is
the
not my question.
specific report,
If
just
you
like
see
I
the
said,
report, or if you don't remember, you say you don't remember.
And
me-
my question, my Lord, is before this court. Are you seeing that report now?
I cannot
for the
answer
first time.
I cannot answer the question.
Okay, my Lord, that can
I would
be
be
okay.
lying in court. I would be lying in court.
Again, Doctor, the reason you are non-committal about this form is because it provides the time of 9:34 as being the time when your client was delivered at the radiology department. And that would sharply contradict your purported time of theater.
Can I respond to that?
Time of theatre that my last friend keeps referring to.
The theater is what, 11?
11. And can I respond to the report, to the question? Can I first answer that question, Your Honor? Can I clarify to court what happens? If an X-ray is taken, this is time of reporting. The radiographer, if he has a line, he can even report in the evening. It is not that he takes the report and is typing, because he has work to do. And me, as an emergency, a person who has been called for an emergency, I want to look at the X-ray as soon as it's taken.
What you're saying,
And the
Doctor,
films,
is
yes.
that, the radiologist,
Yes.
the radiographer
Yes.
can see a patient.
A patient, and then
at
write
this
the
time,
report, and even tell
and
you
then
come.
write the report
Yes. Sometimes they
at
tell you
10
come.
PM.
Yes, come tomorrow. Yes. He writes down his notes and then he types when he gets the time to type, and then the report can accompany the X-rays.
But what-
This is what we do
So
in
is
medical.
this time
Can the report
of
say-
typing?
Can the report say that the patient was brought at 4:07?
In the radiology?
Yes.
No, this is reporting time. The time they report.
Who's reporting time?
The radiographer, this is the time is writing the report.
So the time he puts on the report
Is when he's writing the report. Yes. Yes. When he's
assessment.
reporting, yes. That's why it's called reporting time. When have you written the report? Yeah. And this depends exactly on what work he has on the desk.
Doctor, keep that document there. Give you.
As he checks, can I continue to answer the question a little bit more? Yeah?
You are
The
interested.
same question.
Wait
Okay.
for Mr. Margaret.
About the report. Okay. All right.
And so that we are clear, Doctor, about what you told this court in evidence in chief, for avoidance of doubt, did we get you right when you said the patient was delivered at the theater at 9:43?
That's what I confirmed with the hospital director.
This is what you were
Yes,
told
in this, when
by the hospital
yes,
director?
yes, those are the timelines I was given by him. Because they are the custodians of the records.
Do we get you right to imply to this court that on issues of timelines, you are not in a position to answer to them? They are best answered by the custodian of the record, the hospital director.
Yes, sir. Because the time has really been long. The exact timelines.
Okay, that saves us a lot.
Thank you.
But who shaved Mole Katanga's hair? Do you know?
Your Honor, I managed.
Do you or you don't?
I don't know.
You don't.
I don't know.
So I will therefore be correct to say you don't know who, you don't know when, you don't know from which place her hair was shaved. Am I correct?
I managed orthopedic whatever.
But
I prefer that you ask me the orthopedic injuries because
That's
yes,
why I'm
and I'll
being-
tell you something.
Just a minute,
Yes.
Doctor. I really request.
Yes.
There's no hostility between us.
You know,
and
there's
I
no
think you
hostility,
can
and I'm
see.
trying to answer.
We are just providing
yeah.
this information to
Yes,
us.
yes.
So that's why I'm making it simple.
Yes, simple.
That will I be correct to say that you don't know who, when, and where Mole Katanga's hair was shaved?
I just don't have that
You don't know.
exact detail you are
You
asking.
don't know.
But
Do you know you don't know?
I don't know. I don't know exactly. Yeah.
For avoidance of doubt, doctor, you claimed to have been in theater when the neurosurgeon was purportedly working on
Correct.
KATANGA.
Correct.
Did she have her hair on?
No. When I saw her, she didn't have it.
Okay.
Doctor, if, did you assess Mrs. Katanga for breakages in the head?
I found, because you see, we were two.
Did you or you did not?
Yes, I'm answering. You know, and you should be allowed to answer.
The court has
Your Honor.
provided an answer, let them
Let me answer you, Your Honor. We were two doctors. The neurosurgeon was called first. I found when he had, you know, bandaged and whatever because the patient was bleeding. And then I assessed the what? The orthopedic injuries, and then saw the x-rays, and the decision was made that we are going to do these procedures in what? In theater. Then when we reach theater, the neurosurgeon opens first to do the what? His surgery. And then I come in that at around that time. Because I'm monitoring to see when is he finishing, when is he going to whatever, so that I can know around what time is going to take. And I was in theater around that time.
So do you realize you have not answered?
So the question is,
Let me ask, I wanted
yes,
to know whether you, as
an orthopedic, yes,
surgeon,
yes,
considering what you saw,
yes, what I saw, yes,
and you said you were told that she was bleeding a lot,
yes.
did you interest yourself in whether any of her injuries on the head were orthopedic in nature?
We don't manage anything on the head as orthopedic surgeons. Yes, we don't manage anything on the head apart from knowing the state of the patient. Is she conscious or she's unconscious? Yeah.
So the bones of the head are not...
No, they're not in our jurisdiction to. We don't open the brain.
And you never participated in the management of any head injury?
Can the court finish, my lord? Let the witness answer.
Not something from the doctor.
Yeah.
So the orthopedic was from
Orthopedic starts
bones.
from the neck downward, as far as bones are concerned. And then even the bones of the face we don't touch. Yeah, even the teeth.
And you did not participate in any activity as far as management of the head injuries was concerned?
I didn't participate in managing the head, but I saw.
By the time you see the head injuries, was it before or after the neurosurgeon had worked on them?
I saw the whatever the picture had been taken in the emergency.
Now I
So-
am
so
talking
I
about.
s- and then I found the
Doctor,
patient
if
bandaged.
you- Doctor, please, please, don't hassle with us. Okay? If we interject, listen and know why. I'm now talking about the subject of KATANGA. That is the patient you are managing. Did you see her head before or after the intervention of the neurosurgeon?
I saw before. I saw it before. because the surgeon had to
You
open.
have given a precise answer.
Okay.
Don't provide me information I don't need. Do you know who bandaged her head?
The neurosurgeon dressed and bandaged her.
Doctor, do you know a nurse called Natimba Peace?
I don't recollect such a name.
You certainly know Dr. Onen Justin.
I know him.
And I hope you know Dr. Kavuma Peter.
I know Kavuma, the director of the hospital, and probably there's another Kavuma in the emergency section.
There is a head nurse, or there was at the time, by the names Brian Mayanja. Do you know him?
I know him.
What role did he play on the 2nd of November 2023 in relation to Mole Katanga?
You don't have to visiting here, sir. Do you know what role Brian Mayanja played?
Your Honor, I'm being asked administrative details in the area which I did manage
Did he play
and
any
which
role
I had
in
no
the
interest in
management?
reminding myself about.
There is an objection
Yeah.
asking about
About the head, and yet I'm an orthopedic surgeon.
asking about Brian Mayanja is eliciting hearsay.
My Lord, he either knows the role that Mayanja played or he doesn't. There is no hearsay in that question, with due respect.
I know Brian Mayanja.
Did he play any role in the management
cannot-
of Mole Katanga on that day? Do you remember?
I cannot
or you
recollect what he did. I cannot recollect.
Did you see him on that day?
I think that the questions are becoming...
Too much, eh?
No, they're out of context with what I did.
Don't worry, it is court to determine that,
Yeah,
sir.
that's fine.
It is court.
In my opinion, I cannot answer administrative questions. I am here to answer technical orthopedic questions. And I'm being, taken into the nurses who was there, who was not there. It was a big team. And it's cross-examination, you're fine. But because you imagine in this court, they ask you who was in the corner, who was where. It is so difficult to really be very specific about, I don't know. I don't know. Yeah, I don't remember.
But I think the objection which I want to raise very briefly, not saying the question is because a section from the Evidence Act, it must be relevant. We have got an orthopedic doctor, a consultant, and he's being asked about the work of nurses.
Whether the nurse injected or not, put a camera,
But whether the nurse was part of the team.
shaving of the head, shaving of
The
the
nurse
head.
was part of the team. And supported you all because there are people who pass knives and what.
The orthopedic
So
doctor
I
is
think that's about doctor, not that you know the junior doctors. Now by the time we reach the nurses.
People who
Yeah.
assist in the theater.
It is not easy after 2 years, Your Honor, to be that detailed, remembering everything and what was done by everybody.
That's why
apart from the things you did.
Yeah, that's why
Yes,
I advise
and what you
doctor.
saw.
That's why I'm advising, when we ask what you don't know, don't engage, just tell court that you don't know, and we move to the next question. Okay, so don't get offended by what you don't know.
Yeah.
We are not expecting you to know everything. Okay? But just confirm to this court that Brian Mayanja is the head nurse, or was the head nurse at your facility at the time.
I can confirm that because I know him. He had been there for some time.
Is he still there?
No.
There's a nurse called Christine. She belongs to your department. Do you know a nurse called Christine of the orthopedic department?
Can I answer that? The private hospital doesn't have a nurse belonging to the orthopedic department.
Okay.
It doesn't have that nurse belonging to the orthopedic department.
So
They are nurses,
okay.
and when they are found on station, they do the job.
My lord, do you understand the witness?
So he's
Yes.
saying that
Okay.
at IHK, okay, at private hospitals, there are no nurses for particular sections.
They assist
You
all
just find
surgery.
a nurse
Yes.
and they are
In the section,
the
yeah,
jack of all
theater,
trades.
emergency, outpatient clinic, and the wards, and maybe maternity. So that's what it is.
Okay.
Yeah. But as surgeons, we all share the nurses.
Okay.
General surgeons, orthopedic surgeons.
Okay. On the 2nd of November, 2023, do you remember working with any nurse that goes by the name Christine?
I don't have that recollection. Don't have that recollection.
How about Dr. Tamale Jaffa? Do you know him?
That one I don't remember.
Doctor, do you know Dr. Juma Fauz Kavma?
Fauz Kaumba, now that reminds me of the director of the hospital. Fauz Kaumba, I remember that. I was not remembering the second name, remember. I was trying to remember. But now, Fauz, yes.
Juma
Kavma.
Fauzi Kavma.
Yeah.
is the director.
Yeah. That
Is
is
it
I know that.
You want to confirm that?
I know Fauz.
Is it your position that Juma Fauzi Kavma is the director?
The Juma,
of
I don't know.
IHK?
I know Fauz Kavma. I know the Fauz and Kavma. Yeah. In their
As-
names to that
as
should
the
be
director?
the director, yes. That's what at least I've heard that name being called.
Doctor, at IHK, external correspondences are dispatched or signed off by the director as a matter of policy, correct?
It depends on which communication.
All external communications relating to professional medical services of that hospital, to be specific.
Not necessarily.
Doctor, you told this court that you visited the accused person on ward.
Yes.
How many times? Do you remember visiting him?
Several times. Because she was under my care.
Yes.
Yeah. So I can say several times.
Doctor, for the 2 months, would it be a fair estimation if I said you visited her over 20 times on theater? On ward, sorry, not theater, ward.
Those may be so many, because I remember that I did a post-operative visit.
About how many? To be
In
fair?
the first week,
Yes.
they are like maybe 3 times, but
Okay.
you go on tapering the visit because the patient is getting better and better and better. But I remember that, I run 2 clinics at IHK, and whenever I would go for my clinic, I check on the patient progress, and sometimes I had to change the dressing, and then that kind of care that you give to a patient to ensure that no complication happens.
Okay,
Yeah, in the presence of the nurse and the ward doctor.
no problem.
Okay.
Doctor, would you document your review visits?
Yes, through the ward doctor.
What do you mean?
Yes, I give him instructions on what he should write in the chart.
Did you ever write or make any note in the patient's file throughout your claimed ward visits?
I will need to revisit that in the records.
Do you remember making any?
Myself,
Yes.
I
you are
need
the
to
doctor.
revisit the records to whatever. To prove that I'm the very one who wrote, because you glove, you work, and you give instructions. Yes.
So specifically when you reviewed this file for court, you said you only reviewed things which you did, things which concern you. What did you?
When I dictate, we dictate in medicine. We dictate our notes. We dictate instructions.
Remember,
Because we are,
I'm not
yes.
asking you any question yet.
So
you can go on.
I dictate, and sometimes when the medical officer is busy, you write, and for me to prove what happened. For me, the important thing that I wanted to review is what I did as an
So,
orthopedic surgeon.
Even the review of the file a few days ago cannot inform you whether you made any clinical notes on review.
I am the one who managed the patient, Your Honor. I'm the one who followed up the patient as an orthopedic surgeon, and I'm telling this court the truth. And what I told the court is exactly what I did. I operated the patient, I followed up the patient until I removed the pins and when the fractures had healed.
Well, doctor, maybe, okay, let the court write. Here in court, we cheat exams at times. So the reason I'm asking you these details, cheating exams for you, Mr. Kavika doesn't want me to do so. But the reason I'm asking you these questions is because we have instructions that what you are telling this court is not true. And the only way this court can ascertain that you did what you did is through a verification of your record. So when I ask, you say you reviewed this patient several times, then you reviewed her file just a few days ago. I would be interested in knowing whether that review was capable of refreshing your mind, whether you wrote anything on any day relating to that which you say you did in the patient's file. But it's fair enough if you don't know, doctor.
There should be a record.
Which you reviewed a few days ago.
Pardon?
Does it reflect you as a doctor that reviewed this accused person on ward?
Your Honor, I reviewed the patient. The police records will show you the records of the police where I used to sign and go into the room of the patient, and I manage the patient. And whatever detail I wrote, I can go and check and give you that information.
So you are not in position to confirm
Yes.
whether you wrote anything?
Which day I wrote what, because
No,
when,
I'm not
and
about
I'm going to tell you why I may not do it, because those are now the minor procedures I do, because it's just dressing. It's just seeing whether the patient is swelling is getting down, and then you can tell it to the doctor. The wounds are clean, they are fine.
Doctor,
Let's remove the stitches. So
I'm just interested in a simple thing which any doctor would presumably do.
and
See
I've
a
answered.
patient and put a sentence there that I've been here, the doctor is healing.
When you dictated
Yes.
to the doctor on the ward
Yes,
to write the notes,
yes,
do you find time at the end of the day
yes.
to see whether what you told
What you,
them to
yes,
write is
yes,
what they wrote?
yes, what they wrote.
So
And
did
to
they-
ensure that they
So did they write
they follow the
anything?
instructions, yes. Because this patient
Doctor,
was reviewed.
Whoever you were instructing to write, did they write anything in the file
Yes.
in respect of your reviews?
Yes, there are review notes in the patient's file.
Okay. We were veiled some which we believe to be the file. It is the perioperative record,
Perioperative,
perioperative
yes,
record of the patient.
yes.
I want you to have it.
Let me, as I have it, let me define perioperative, Your Honor.
Doctor, leave that for your students, kindly.
Okay,
This is court.
all right.
Okay?
So you don't want me to clear
No,
what
don't assume that we don't know. You see,
We've been asking.
Okay,
we shall ask you.
all right.
For now, concentrate on what we want you to tell court. No. I gave you the entire bundle.
Yes.
Eh? Which one? Already. Okay. As the doctors managing the accused.
Yes.
When is it dated?
Second of November 23.
What were you managing according to the form?
The injuries I detailed to theater.
Doctor, do you want to look at your own form? On page 2. Can you read to court the patient's history and examination?
This is not
Can you read to court what is contained in your form
now.
in respect of the patient's history and examination?
This was written by the neurosurgeon, and he wrote about his injuries.
Doctor, can you read?
Yeah, that
Please read.
deep scalp
No,
wounds.
it doesn't begin there.
Can you instruct me on the page?
Page 2,
Another
under
page.
patient history and examination.
Yes.
Can you read what
Tip-
is written?
TBI with deep cut scalp wounds following RTA, known hypertension.
What is TBI?
I don't usually use that abbreviation, Your Honor. That should be. I'm not the one who wrote.
Again, my note, that's exactly the form.
You,
My note, this is the objection. That's exactly the form I took him to, where I was told to limit myself only the things that he wrote.
What? Did you write anything on that?
no,
Yes.
I didn't write. Where on this one?
The last page.
Yeah, I wrote my notes.
The last page.
So, but I didn't write this.
My note, and the objection was very specific. I gave him that form, and the objection was he should limit himself only to the fact that he wrote, which was on the last page.
So there's nothing you wrote on.
Yeah, there's nothing I wrote here.
The top of that was written by Dr. Nen.
I don't want to say it's either Dr. Nen or the anesthesiologist, because I see a part of dentition, and usually the anesthetists are interested in that because they're going to pass, Yeah. So, yeah, but I cannot prove that this is his handwriting. So it could be an anesthesiologist. And actually the form has perioperative anesthesia record, so that should be most likely the anesthesiologist who wrote it.
Doctor, did you interact with this form in the process of management of the accused person?
I don't remember.
Don't remember. I want you to be fair and confirm to this court that this is the form that is supposed to be used in the theater in the management of the client.
Your Honor, there is different people managing the patient. There are different people managing the patient, from the nurses, the anesthesia
My
team,
Lord, can he answer to my
and
question?
the
I have
surgeons.
not asked that question, and
So-
I really,
so
really
part of
request,
those-
I
yes.
really request that the doctor,
Restrict yourself.
the
Yes.
doctor,
Don't worry. If there's
So,
anything
so,
that is
so
not
this
clear,
is
you
this
will
is
ask
a
to be examined.
perioperative anesthesia record.
Doctor, is that
I don't remember because it's not primarily where I write my notes.
I do not remember interacting with this form
Because
of one agenda.
my interest is
Then
somewhere
another
else.
question was asked.
Mr. He has defined it as a preoperative anesthesia
Record.
on page 2.
yeah, it is
The record of the anesthesia's.
it's okay. It's okay. So I'm breaking it down, my lord, in simple terms. Is this supposed to be the theater record for the patient? He either knows or he doesn't.
I know that the anesthetist reviews the patient and writes something in the file.
But does it take place
And
in,
me, what I do,
does it take place in the theater?
it can even take place on the whatever, on the ward or in the emergency, depending on the situation.
An anesthesia.
Yes, they can come out and first review the patient to see whether they are fit to go into theater. So it can happen anywhere before the surgery takes place.
Doctor, why would Doctor, it is in this form that operation notes are made, correct?
No. There's another form where we make operation notes, which has all the records of the pulse, the pressure, the anesthesia drugs, and everything. That's where we make at the end of that form is where we make the operation notes.
At the end of the form.
Yeah, at the end of this form.
My lord, the witness has denied that this is not the form where theater notes are taken.
I don't write on this form.
Sorry?
I don't write on this form. That's for the anesthesia, pre-operative assessment.
He himself
Yes,
doesn't write.
and the procedure is that you should assess the patient before they go into what? Into theater, and write something. Then in theater we have the operation notes, and where we write operation notes.
And you say for you, you write on the last page, right?
Yeah, I wrote on the last page.
Go to the last page. I put
Yeah.
the stapler is flying.
Yeah,
The page is there.
yeah, it's there.
Do you see your handwriting?
Yes, I see it.
What is the page number where you wrote?
It's page number 15.
Page 15.
Mm.
What is on page 14?
So it is operation notes.
Okay.
Mm.
Confirm that this form is page numbered sequentially from page 1 to
Yes.
page 15, where you wrote.
Your Honor,
Is it or it is not?
can I answer the question?
Yes.
Yes.
Is the page
Yes.
numbered
Sequentially,
15?
from 1 to 15.
1 to 15.
Page 1 to page 15.
Now,
So, doctor, you wrote.
Have you answered?
yes,
Have you
pardon.
answered?
From page 1,
Go from 1, 2, 3,
Up to 15,
3,
where you
4,
wrote.
up to 13, and then there's the operation notes.
Does it go from page 1 up to page 15, where you wrote? Is it numbered sequentially?
It is numbered sequentially up to page 13, but I don't see the number on 14.
You don't see the number on 14?
I don't know whether that's...
If you look at the stamp, you can see number 14 in the stamp.
Oh, yeah.
Obviously.
Yeah, you can
You've
see
seen
it.
it, eh?
Yeah, you can see
And
it.
yours is page 15.
Yeah.
Okay? Yours is 15. Right?
Yeah, it's 15.
So you wrote in this form.
Yes, I wrote in that form. That's my handwriting.
What is the heading
It's clinical notes
of your writing?
of my writing because the form was full. My colleague had written where I'm supposed to write.
So you had the did clinical
Yes,
notes.
yes. No, what I'm saying, I'm not the one who had it. You get extra space to write your notes, okay? Because I did the operation.
My lord, which question is doctor answering?
You asked him what the heading is.
The heading is
That
clinical
should be a
notes.
simple question.
Yeah, it's clinical notes.
I think my what was clarifying is that it's typed clinical notes. But you know that he wrote. He wrote the one word he wrote. The heading is there. My mother asked me what he wrote.
Interpretation, my lord. As a surgeon, before you managed this patient, this your patient, did you interest yourself in her vitals?
Yes.
Why would you be interested in a patient's vitals as a surgeon?
To make sure that she's fit and to know that I need to be quick in executing my duty of operating her because I need to know whether she's very critical or she's very stable in that regard. As a team. But the main person in
Doctor,
assessing
you've
that
answered me, but
is the anesthesiologist.
I'm now asking about you. Other questions for the anesthesiologist, we shall reserve them for him or her. Can you go to page 4 where our vitals were recorded? Page 4. Doctor, first, I want you to confirm.
I'm sorry to keep interrupting my colleague, but he really objected to me taking this witness to any page on this document of the witness. So my lord, the same rule must apply to him.
I think, my lord, what my colleagues, with the greatest respect, should know is that the rules of leading evidence in chief are strict and restricted. My lord, in evidence in chief, you only lead witnesses to things that are provable by any of their 5 senses. There must be things within their knowledge. My lord, in cross-examination, there is no restriction as to what question can be put to the witness. And it is up to the witness, my lord, to choose to tell a court whether they know or not. My lord, in cross-examination, I can even choose to deliberately ask a witness questions that I know that they are not supposed to know. And it is up to them to choose whether to tell the truth or to lie to court. We know that the only prohibited questions under the sun are questions that are offensive, scandalous, etc. So we don't know, my lord, under what legal provision we can be prevented from us putting any questions to this doctor, especially, my lord, questions that he is supposed to have reviewed, questions that he undertook. In this case, it's even better. He says he found that vitals are very necessary in dealing with this patient. And then we are taking him, my lord, to where the vitals are recorded.
My lord, much as my learned friend is free to ask any question in prose, the question has to be relevant to what the court is trying to go through. But my lord, at page 4 of this document, there is nothing. It is totally empty.
Which document are you?
Yes, page 4.
Which page 4 is that?
This one.
No, we're on page 4 of assessment form. Page 4 of assessment form.
But my lord, also just, my lord, the only limitation on examination in chief is the statute limits you to not asking leading questions. Yes, that is what is in the statute. My lord, hearsay cannot be elicited either from cross-examination or through examination in chief. But anyway, maybe my colleague can continue and see where he's going. We just put you on notice. We shall object to elicitation in the
My lord, they are either making a substantive objection now because it will keep coming.
Yes, my lord, the substantive objection is he cannot elicit hearsay during cross-examination. And the statutory limit is on that. But since he's asking questions, he should ask that question with that in mind. That in case he violates that, we shall legitimately object.
First of all, my lord, there is no hearsay to doctors per this your hospital record. This accused person on arrival was assessed and found to have been fully conscious, awake, alert, and well-oriented. Correct?
It's correct according to what they wrote.
My lord, she was fully conscious, awake, alert, and well-oriented.
According to what he wrote.
Yes, according to the vitals.
To the vitals.
According to what the nurse wrote.
Right, yes.
According to what the bank.
The nurse.
And those the vitals?
My lord,
Yes,
but
my
they
lord.
have nothing to do with vitals, those are nursing notes.
According to the notes.
Nothing but.
Is that what you are referring to as vitals?
Yes,
or
my
you're
lord.
going there?
They are doctor. These not the vitals that you assess before operating on a patient.
This is
The content of page 4.
now this when you comment, this is a CNS examination by the nurse.
What
At
is CNS?
vitals.
Central nervous system
No,
examination by the nurse. It is CNS.
Okay.
Yeah. So let's go to the vitals that you're talking about.
So according
So
to the CNS.
Central nervous system examination. Is the patient alert? Is he cautious? That kind of thing. So that's what the nurse wrote when she arrived.
In medical terms, for you to say that a patient is fully conscious, it means that that patient is awake, is not drowsy, and is spontaneous. In other words, he responds to voice and touch. Correct?
That is correct.
Hello, do I repeat for court?
Fully conscious.
Means that the patient is awake, not drowsy, spontaneous, and responds to voice and touch.
Doctor, in what is spontaneous in medical terms? If someone says patient was spontaneous, what do they mean?
Where is that statement? I don't see that statement in the CNS examination. Oh, he was trying to say.
I think court is asking you a question,
Yes,
not
she's
necessarily
yeah.
in the document.
But I'm not a neurosurgeon, though. But I studied this in my undergraduate, and in my practice, I know that we assess the central nervous system of the patient.
So if they say someone is spontaneous,
That
It means that
they
person
respond
respond
to
voice
instructions.
and
Yes,
touch, or instructions.
instruction. There is response to instruction.
But not the word spontaneous is not there in the notes.
no,
It's from Mr. Morgan.
yes, and the doctor is.
And it's in the area of neurosurgery, but
Because they
I'll
they
offer
ask be
to
very-
answer it.
Because they ask him to be fully conscious means,
So the definition was mine, and
and
he confirmed. It means that the patient is not asleep or unconscious. Correct?
The patient who is awake is not unconscious.
Not unconscious. Again, doctor, when you medically say that the patient is alert, it means that that patient was capable of immediate responses by normal stimuli. In other words, they respond without delay or confusion.
Your
Correct.
Honor, I'm going into neurosurgery. I beg to be.
If you don't know,
Yeah,
tell court
I
you
beg
don't
that
know.
the neurosurgeon comes and answers a little bit of the details of the neurosurgical examination.
I'm asking you
Because
as-
these are things that have been written by a nurse, and I'm an orthopedic surgeon.
Yes, doctor, when they say that
So I
patient is alert, what does it mean? Or you're not able to answer?
What I'm saying is that there is a more qualified person than me to answer, but I know that alert is an English term that you can see and you can hear and you can respond to pain.
Fair enough.
That's what I know.
And that's
And of
exact-
course,
that's
the
exactly what we are
neuro
looking
people
for,
will
doctor.
grade the alertness. It has grades. So, but they're the ones who really did the detailed assessment.
We are only asking things within your knowledge.
Yes, Mr.
My lord, I think as the witness is saying, my lord, I think the witness should be limited to what is maybe it is the orthopedic work. I think asking him for central nervous system examinations is unfair.
But those are some of the notes that he used.
Yes.
Inform him.
Operations.
That's what we say. Isn't that part of the note?
So these are the notes which are written by the nurses.
Yes, but don't you
The-
use
the-
those to
the-
determine how to?
But you see, I was managing the minor, what I call the minor injury, the patient, right?
Don't worry.
And there's a neurosurgeon who is managing the major injury that, as I said in my definition of the injuries the patient got, the grievous injuries were on the head.
Yes, but not.
So,
That-
so if my colleague has already assessed my attention to detail, because I'm not the primary surgeon, it may not be like as detailed as he is, because he's the one managing the brain. And
So for you, you wouldn't.
yeah, I mean, if he has already assessed and the anesthetist has already assessed, I trust them to be the ones who are primarily, taking care of the vitals and everything else. much as I may be interested in knowing that the blood pressure is like this and whatever, but this is 2 years down the road and whatever, those details may not be
Let's make
registering
it 2
very
years
well.
down the road,
Yeah.
Ordinarily.
Yeah, ordinarily.
Assuming
If
that
I was the
patient
primary
came-
surgeon.
If the patient came
Yes,
today,
yes.
and the circumstances
Yes, we
are
discuss.
as they were
Yes.
on second,
Yes,
would those interest you or not?
they would
Those
interest.
things.
They would interest me as a surgeon going to do the operation. Yes.
That is
So
the
I need to
important.
know, and the anesthetist
If I can
is
just
the
put
primary.
my objection properly. My lord, this form that my learned friend is talking about has information for both the neurosurgeon and the orthopedic surgeon. So even the vitals we are talking about, we're talking about fractures on the hands, we're talking about deep forearm and ring finger, we're talking about bilaterally distal forearm and fingers can move lower limbs. So my lord, when the doctor says this is something he can look at, my lord, the context is that there's information here for neurosurgeon and there's information here for orthopedic surgeon.
There's information that serves both of them.
But certainly not the central nervous
that is
system.
general. No, but if they tell you about how the patient is fully conscious,
No, that's a central
awake,
nervous
alert.
system
No.
examination.
No, but even if there's a central nervous system examination, does it concern him?
He says,
Yeah, he's saying as a surgeon, those are some of the things that.
And yeah, they concern me.
Yes.
But remember, this patient is being assessed by an anesthesiologist, by the neurosurgeon, and me.
But do those parts concern you?
They concern me, of course. But I'm not the one to make the decision whether to operate or not to operate. It's the anesthesiologist.
That is fine.
So,
Doctor, when a patient is medically said to be well oriented, it means that that person knows their name, knows the place where they are, for example, that I'm in hospital, also knows the time in terms of day, month, and the year, or at least that it is morning or evening. In other words, being well-oriented means that you know your particulars, you know the place, you know the time in issue. Correct?
yeah, we do orientation.
Correct or not?
It's correct.
Okay, that's
It's correct.
sufficient, Doctor. Interpretation, my lord. So we just wanted to do one thing, my lord, first before we pray for an adjournment. Doctor, we want to respectfully again put our instructions to you that you are not anywhere at IHK between the hour of 9 o'clock and 11 o'clock, as you earlier told this court in your evidence in chief.
It is false.
My lord, we believe we can begin from there when we review.
Are you still using the dates? Witness has said they'll be available. They are not available Monday and Friday. And Wednesday. What else you expect?
Tuesdays.
You're not available Tuesday?
No, I will be available on Tuesday.
Are you available Tuesday?
not available.
Tuesday we indicated we
They
are
are not
not.
available. That is 30th.
Yes.
So I don't let's keep the days we got. Monday, Wednesday, and Thursday. Then we will, if anything changes, we will write to court and communicate. Let's keep the days. We will be available. If we fail to adjust with him, we will introduce another witness. We don't want to lose time.